Welcome everyone to this interview between Jack and Pradeep. We have very exciting news to share with you today, and this is really amazing stuff. So first, if we can introduce everybody, my name is Jefferson Nunn. I'm your host today, and we have with us here Pradeep Goel of Solve.Care and Jack O'Halloran of SKALE. Pradeep, could you introduce yourself?
Hi, Jefferson. Good to see you again. Hello, Jack. And it's good to see everyone on the other side of the camera. My name is Pradeep Goel. I'm the CEO and founder of Solve.Care, and we are a healthcare platform that has been in existence for about 3.5 years now, with the objective of really normalizing and transforming the patient-doctor-insurer relationship. And we have had a great journey so far, and we are looking very excited about what we're going to discuss today here, the partnership with SKALE.
And Jack, could you introduce yourself to our group here?
Hi, I'm Jack O'Halloran. I'm the CEO of SKALE Labs. We are the core team behind the SKALE Network. So the SKALE Network was created to help drive efficiency and greater usability of blockchain. So anyone building on Ethereum can take that application, connect it to the SKALE Network, and all of a sudden run at incredibly high speeds, low costs, and really help bring the promise of blockchain to reality. So we're excited. I'm excited to be here today, and really excited about the announcement, and just a lot of I think blockchain is about to have a few very, very big years in terms of real traction, and healthcare is one that I'm incredibly excited about.
Which is really awesome. I know healthcare is a $1 trillion industry, at least in the US, and globally probably even more than that. So Pradeep, could you maybe discuss a little bit more about how Solve.Care is already making a difference there?
Sure, Jefferson. So I echo what Jack just said, and I'll add to that just a bit. So Solve.Care as a platform is designed to launch ecosystems that connect different patient groups and different provider groups and different administrative and financial entities into one secure ecosystem that is really built on the principles of autonomy, sovereignty of the participants, their ability to transact with each other safely and securely, real-time payments using digital currency, and automating everything that today goes on paper or by email or other custom-built systems. So the idea here is very simple but incredibly challenging, in that how can we allow a single platform to serve the needs of healthcare participants around the world? And the answer is you do that by creating a need-specific ecosystem that they can elect to join in. And our philosophy is the patient is at the center of all of this rather than an afterthought. The provider is an equally important participant, and then all the other administrative and clinical and financial entities, their job is to ensure that the right thing gets done at the right time. So we are essentially solving the very fundamental issue of trust in healthcare, where these entities typically are unable to trust each other for business and geographic and roles reasons. So you end up with everybody trying to enforce upon everybody what is considered to be the appropriate protocol of care. And by using blockchain, you can actually align everybody to the same protocol. We have it be transparent, auditable, enforceable, and whatever everybody does can be measured against a protocol in real time. And you can enforce patient privacy, consent, security, patient rights, as well as that of the provider, as well as that of the insurer. So long and short of it is, we started with the idea that we're going to allow for rapid launch of these ecosystems. We refer to them as care networks. So a care network can be local, regional, national, or global. And depending upon the network design, different types of participants can join it: parents, patients, family members, employer, employee, pharmacist, and so on. And each of these ecosystems uses a permission blockchain, which syncs up to our main net, which is the public view of everything. So long and short of it is, now we can balance two sides of the coin: privacy and rights, and transparency and coordination. And finding that balance is really the essence of what blockchain can do. So we've been successful in launching this in the market. But today we see certain constraints around cost and transaction speed and scalability of the blockchains that we have launched. And this partnership with Scale really helps address some of those scalability and rather global expansion strategy that we have in place. It helps us move further down the path faster. That's why we are excited about what Scale brings to the table.
That's awesome. Jack, could you tell us a little bit more about Scale Networks, how it works, and what's next?
Yeah, I'd love to. And actually, before I do, I want to talk a little bit more about healthcare and life science. So I have about 10 years of experience prior to this working with life science companies and healthcare companies. I was a founder of a company called Octana, which almost every major pharmaceutical biotech company in the world uses. So an example I would use inside a healthcare organization is it's as if there's this piping and connectivity that, we talk about blockchain interoperability, and it's as if every single hospital is running 10 or 20 different blockchains, okay? Because these databases don't connect. And when you integrate blockchain across not just one hospital or one healthcare organization, and you connect it actually to individuals and people, all of a sudden we get this dynamic where you have people, as Pradeep mentioned, the patient is the center point. And if you think instead of databases connected around the world that can't speak to each other and needing to put the patient second, instead you have the patient and you have one webbing, one platform, one piping, and that's what blockchain can do. And I think Ethereum is proving it's the rails and the Ethereum standard. So when Pradeep mentions private blockchains, when he mentions having like public and private blockchains, they're all running essentially the piping of Ethereum. And so Ethereum now is connecting, in the future, I believe over the next 10 to 20 years, the rails of Ethereum will connect every major hospital, every major pharmaceutical company, and the center point of all of these pieces are going to be the patient, okay? Now, one of the issues is blockchains are slow because every single computer on a network needs to be running the exact same data set, okay? And when every computer has this symmetrical piece of software, and it's all built to talk to each other, the bigger that software gets, the slower it can get, okay? Now, the value of that is that you get symmetry amongst every single data set and interoperability and connectivity. And so that's highly valuable. And then you also have the whole private and public component. Private blockchains have the ability to basically pare that set down to specifically who's using it. Public blockchains have to share all the data, okay? They can get really slow. They each have their different pros and cons. And when you look at the Scale Network, why the Scale Network exists, it actually gives a lot of the advantages of private blockchains in a public blockchain environment. So the Scale Network is a broad public open network with many, many computers all running the same data sets. But what happens is let's say we have a decentralized rideshare platform and we have a decentralized healthcare network. Each of them, when they come to the Scale Network, they actually get their own component of the network that's randomly assigned to them. And so you get this security and breadth of this large network, while each application or company or business or entity gets its own piece of this network. And then what that means is it can be fast, low cost, and have advantages of public blockchain networks. So I'm particularly excited about Solve because one of the issues with blockchains is that you see a hash and there's just public data. They have technology that's able to let healthcare institutions actually use the advantages of public ledgers while protecting the privacy of the information. And then as scale comes into the equation, instead of paying for public blockchains, instead of paying maybe $1 or even for heavy computation, hundreds of dollars to execute a smart contract, they're gasless. It's basically free. They're able to rent the blockchain from this open network for periods of time, for a year at a time, 2 years at a time. And that's the only cost. And then they have very predictable costs, great user experience. So that's why Scale exists is to ultimately help industries achieve these goals. And with blockchain, and healthcare in particular is one I'm very excited about, because there's a foundational issue of just even being able to connect information. And we all know that you go to a doctor and you're like, you have to give them all your information all over again. You're like, how come I can't just plug into a web of data? So I'm pretty excited about this space.
That's awesome. So maybe thinking about like one of the applications that we have that Pradeep already had, the Global Telehealth Exchange. Can we talk about how this partnership will make that even more effective? So maybe Pradeep, do you want to start?
Sure, Jefferson, that's a great example, actually. So Global Telehealth Exchange is a truly open global network for any doctor in the world to sign up, prove their medical qualifications, and then see any patient in the world. And the patient simply need to download the Care Wallet no matter where they are, and they can find physicians that are willing and able to accept them as a patient based on mutually set criteria. So patient's age, gender, disease condition, country, ability to pay, urgency, all those factors can be automatically matched to the physician availability. So first thing we do is we get rid of the wait time. When there is a need, there is an immediate search for the physician, and the physician nodes can respond to that need based on the absolute immediate availability rather than something in the future. So we eliminate all the wait, we eliminate all the friction processes. Payments are instantaneous in the form of Solve token payment from patient to provider. So there's no billing, no collection, no write-offs, no delays, no hidden costs, no surprises. So those are the reasons why we believe a truly global open network needs to exist, and we have built it. So it's just an ecosystem, a care network in our vernacular, but it's built to solve a very fundamental care access problem. But having said all that, Global Telehealth Exchange will need to comply with rules and regulations of each market. So whether you have physician in India or in Indonesia or in Indiana, you're going to end up with slightly different configurations and compliance rules. So the architecture of Global Telehealth Exchange then is to have these semi-autonomous blockchains that sync up to the global registry and global payment blockchain. So it's sort of like a network of chains. So what we see doing with Scale then is identifying high utilization chains. So let's say we have a group of countries that are really transacting very highly in teleconsultation. We can isolate their workload onto a Scale network fragment, if you will. And then we can run the other bunch of other lower capacity, lower utility blockchains and group them into another Scale fragment. So the idea then would become that we can do very clear geofencing, we can do resource allocation, we can do separation of data, we can protect and comply with different levels of transparency and auditability of each of these chains, which our platform does anyway. And we could do all that today. With the absence of our partnership in Scale, we're doing that, but Scale makes it so much easier and so much faster. So we are in that process of figuring out all the possible ways we can leverage the Scale ecosystem as the hosting environment, for a lack of a better word, for GTHE. But the point is, no matter where we are today, in 3-6 months, we're going to look differently based on utilization and speed and cost and transactions. But that flexibility is powerful. So in a nutshell, what I'll say is this. 3.5 years ago, when I started to build the Solve.Care platform, my team came to me and said, this will require us to have a hosting environment which is semi-distributed, semi-decentralized. We couldn't use fully public blockchains. We also shouldn't be fully private, in which case there's no decentralization. So what's the bridge? And I said to them, don't worry. In the next 3 years, the market need will be apparent and companies will come up to solve that problem. You build the ecosystem with the assumption that a company like Scale would exist. Of course, we didn't know the name back then. So I said, don't worry. There will be a market. There is a market need, clear. In 2 to 3 years, that need will be met by innovative, entrepreneurial, and capable companies. Till then, we can operate at a relatively higher cost infrastructure. But when we are truly starting to scale, there'll be others who will be there to help us. And this is exactly where we are. 3.5 years later, we are ready to go global, and we would want to bring the infrastructure onto a platform like Scale, because that's what we anticipated and we expected, and they're filling a need. So that need was clearly identified almost half a decade ago. And now we are excited to actually see that the solution arrive in the market that we're going to deploy on.
And that's amazing. And I'm also excited about some of the even the future possibilities that can come as a result of this. I know there's already definized and there's probably more coming, to where you mentioned an innovative entrepreneurial web developer can maybe, or blockchain developer can do something. So Jack, on that basis, what do you think about what's next with this partnership? What could somebody that's wanting to build on top of this platform that Pradeep and you have already built, where could they go next?
Yeah, I think Pradeep. Well, I'm going to go back to something Pradeep said. So,
Oh,
the 3 years ago, we were. It was, I guess, more than 3 years ago now. It was 2017. I'd been working in Silicon Valley at tech companies for about 14 years, and was getting ready to start another machine learning AI company, and decided, blockchain hit this point, this inflection point where there are actually real business use cases. And it dawned on me that this not only was an exciting industry with cryptocurrency and things that we saw happening in gaming and other functions, but blockchain had the ability to permeate every other major category. And so we started working on something I was looking at a number of different areas. So was my co-founder, who's, I think one of the world's foremost cryptographers with over 20 years of cryptography experience. He was at Stanford and studied a number of other institutions as well. But we decided to go tackle this problem set. And it took a long time. It took us over 3 years to be able to build this with a huge team, massive funding. And so when Pradeep's saying he knew this would come, it's because the product market fits there. Entities like Scale and entrepreneurs like myself, we're looking for these categories, okay? And so to your question of what's going to happen next, well, we're finally here at this inflection point where we actually can have low costs, high speeds, and enable these phenomenal use cases to go and perform and not be encumbered in the way they were before. And so as an example, when using a public open network before, it might cost you just to send a token. People are familiar with that. It costs $10, $20 to send Ethereum some days, okay? But when you actually do a computation, what you're doing is you're using gas in the network. It can cost hundreds and hundreds of dollars, right? And I think anyone who's used Synthetics network, right, and you are staking in Synthetics, it's hundreds of dollars just to perform a very simple action, because that action has to take place across servers all over the world. So now on Scale, instead of it taking minutes and hundreds of dollars, it takes a second and really almost no cost, because you're able to buy space in a blockchain the same way you buy software in like a subscription manner, using Scale tokens. And that's the value of the Scale token. So hey, I think what's next is we're ready for takeoff. We're excited to go get the first use case, and Solve.Care has as many, I think, incredible fronts in the way they bring this core technology to market. And I think we're excited to support all of them. And also, as Pradeep said, be able to support them in not just one single blockchain, but they're going to be able to take small pieces of the blockchain, of the Scale blockchain, and apply them specifically to different problem sets. So yeah, it's really about helping take all of the phenomenal businesses and use cases for blockchain to the next level. And I think we're finally there as an industry. It's an exciting time to be working in the industry, to be following the industry. And yeah, so that's it. It's go time. That's the next step.
Well said.
awesome. Well said. I'm just at a random thought. I remember in the early days of COVID, they had, the ventilator need. And it was really, if you follow the news in the US, they didn't source, distribute, or anything about those ventilators in any kind of a logical fashion. So perhaps as a problem set, as you mentioned, and I know this is strictly theory, but what if somebody, entrepreneur, that was an entrepreneur, came along, solved this problem of ventilators, wanted to use Solve.Care, wanted to use Scale, how would they get started? 'Cause that's where I think there's an opportunity. How would they get started?
So I think there are many ways we can look at that, but the fundamental value proposition that I think the industry as a whole can and should serve in addressing healthcare needs globally, I think, is to do well and do good at the same time. And I believe that decentralized finance represents an opportunity for the world to respond to healthcare needs without having to wait for institutional capital or approvals. And I think we're seeing more and more migration of finance from fully controlled model to a community-owned, community-driven model. Now, there are issues with that, but there's definitely, if you think about healthcare in particular, Solve.Care is currently launching partnering on a major DeFi project called Definitize. And I want to talk about what Jack just said. So Definitize is a decentralized finance platform for healthcare projects. And the notion is very simple. If there is a worthy project, let the community vote on it. And if the community likes it, they can fund it. And they can have absolute transparency on where the money is being spent and where the revenue is coming from and what the returns are and what the risks are. A completely decentralized autonomous organization to replace a centralized financial mechanism that we see worldwide. And we want to particularly use it for healthcare, although it's open to be used for any other purpose. And the Definitized Constitution is written to say, first and foremost, protect and help the patient. Second, help the provider in doing their job better. And third, do well and do good at the same time. So let's take that example. Jack just mentioned staking and voting. All DAOs, all decentralized autonomous organizations, are going to require community to participate and vote. If the voting is going to cost a lot of money, people aren't going to vote. If staking is going to cost a lot of money, people aren't going to stake. Not the average non-crypto enthusiast who has the understanding of that. So we totally see the Definitize financial solution and community to leverage a platform like Scale to do elections, to do proposals, to do voting, to do withdrawals and deposits, to do distributions and redemptions. Because in effect, we are saying that everything that Goldman Sachs and JP Morgan Chase combined do, we can do that as a DAO, as a decentralized autonomous organization. You do need them, but not for everything. You can do a lot better, a lot more when it comes to funding projects that are worthy of our attention, be it vaccination program around the world or supporting ventilators or supporting custom prostheses for children without arms and legs, or providing research for new drugs, or whatever we as a humanity decide. So we do need to address the fundamental value of cryptography and the crypto industry is to bring the power back to the person, right? Decentralization has a reason why it is popular and why it catches the attention of all of us, even those who have grown up in the system, if you will. And I, having spent decades in healthcare and in government, can tell you I'm as much a product of the system as anybody else. But you see what decentralization can do. It's not just some technological fad. It's empowering the average human being to make decisions, to take control over their things. But for that, they need to be able to afford the participation. You can't charge somebody a $40 gas fee to cast their vote in for or against a proposal, or to deposit their tokens, or to withdraw their vote, whatever. And the same thing with the patient trying to book an appointment with the doctor. The appointment booking fee cannot cost more than the appointment itself.
Right.
Most appointments are going to cost $10. You can't say to them $40 is the cost of making the appointment transaction on Ethereum. Therein lies the opportunity to work with technologies like Scale and Solve.Care. But in the nutshell, to your answer, Jefferson, what I would say is that community-powered projects is the answer to fueling innovation, but that community-powered projects need efficient community infrastructure. And that's where I think we are moving towards quickly here. So not only are we talking about global telehealth exchange, as we roll out Definitize as a truly decentralized autonomous organization, we would look to Scale for rolling that out as well.
Awesome. Well, this has been an amazing launch. Are there any final thoughts looking toward the future and what next? Jack, why don't you go first?
I feel compelled to respond also to what Pradeep just
Sure.
said, because there's two really critical things I want to call out there, and then I'll tie that back to the next steps in the partnership. So number one, the blockchain does not discriminate in terms of pricing and execution time in terms of what it's executing. Whether you're booking an appointment with an oncologist that might be worth $5,000 per hour, or you're sending a vote for something that could be something very tiny with a small group of friends, the blockchain is going to charge you the same amount, okay? And that's one of the issues that I think we diagnosed a long time ago. We said, we're not going to get to serving billions of users and bringing the power of blockchain to billions of users with this, business model issue. It doesn't work, okay? And when you do want to have, a patient and an oncologist conversation, then you can bring all the security and the cost and the weight to that, and you get ROI. But for all of these many thousands and millions of transactions that need to happen per minute on blockchains, we need low cost options. So that's why Scale exists. Okay. The other piece of this, and hey, my last company, I've almost every single person who's had a prescription, whether it be for primary care product or an oncology product or you name it, in the US, Japan, China, Europe, that's driven in the back end through analytics of the prior company I started. And I was getting ready to go start something else in the analytics space. But you know what? I was captured by what Pradeep was talking about. Is we can actually do good and help evolve the world and bring power to users. And I like talking about the democratization of business. And so right now, businesses, especially healthcare, life science, finance, the power lives amongst a few people at really large entities, and they make decisions then for the broader group. And those decisions are not always the best thing for each user. They're the best thing for the profit line, okay? Now, blockchains, and because of the nature of DAOs, decentralized autonomous organizations, we're able to bring that power back to the users, as Pradeep mentioned, and that's something I'm incredibly excited about. And one of the things I'm passionate about this partnership. I think there's a philosophical alignment, and the main thing I care about, I hope we just go out and can make a positive impact on the world.
Absolutely agree, 100%.
It's going to be amazing, Pradeep. Any final thoughts on what next and what we're doing?
Well, we covered a lot of ground. So thank you first, Jefferson, for hosting the interview, and thanks, Jack, for joining this. I'm excited to what lies ahead. I think the only thought I'll have is that there's a lot of potential in this partnership. We need to take step by step execution, ensure that we execute in a manner, both of us, where we continue to do good and right by the patient and the provider and the other healthcare stakeholders. Healthcare, unlike many other industries, impacts us directly and personally. So we have a huge opportunity to do that, to impact that positively. Solve.Care has been on a mission for 3.5 years to do that. Scale's been on a mission at the same time in parallel to facilitate what we are trying to do and make that more financially sustainable. And the timing is perfect. So now it's just a matter of working through the details and bringing solutions to market. So we'll align our teams and their teams and get moving. It will take some time, but this is a worthy investment. So given all the other demands on our resources, we are very careful as to who we will or will not partner with, because there is only so much we can do. But we chose to go down this partnership path because we see real value for the average consumer that we are really trying to bring this solution to. So excited. Thank you, Jack, for being a partner, and look forward to the next phase.
Thank
Likewise.
you, everyone.
Really excited. Thank you, Pradeep.